Doctors are scrambling a little bit, too. Dr. Seema Yasmin is a former CDC disease detective who spent 2 years with the Epidemic Intelligence Service Squad of Contagion Hunters. She's now an assistant professor at Stanford. And Dr. Amesh Adalja is Johns Hopkins University public health senior scholar and expert on infectious diseases. Both join us tonight. Dr. Adalja, thank you very much for coming to us tonight. Are we overdoing the worry about this outbreak? And the reason I ask is, obviously, it has been spreading in China a great deal. But in the United States right now, there are 110 cases or thereabouts in a nation of 300 million. That case count could quintuple tomorrow, for all we know. But it is still much smaller than the common flu and many other ailments, such as pneumonias. Are we over-worrying this?
I don't think we're over-worrying, but we don't need to panic. We know that this is an efficiently spread respiratory virus that can really go through a population very quickly. And I do think we're going to see more cases in the United States, and we need to prepare for that because many of the cases, although they may be mild, are going to be a burden on our healthcare system, and we need to be ready to deal with them. So we will see case counts go up. We will see community spread occur. And I do think we need to really think about the hospital preparedness that we have in this country. So I don't think it's an over-worry. It's just something you need to be alert about, but not panicked.
But people are taking steps. They're not going out as much. We're hearing anecdotal reports that airplanes, doctor, are not as full as they used to be. We've seen people going to Costco and stripping the shelves bare of essentials. Is that called for, or is that hysteria?
I do think there's a very fine line between being alert and being proactive about preparing versus being panicked. And we are seeing panic buying. We are seeing people proactively cancel things that we don't necessarily need to be canceling. We see people deferring travel that may not necessarily need to be deferred. You have to remember, this is going to be here. It's going to be with us for a while. We're going to have to get used to the fact that this new novel coronavirus is likely going to become one of our seasonal coronaviruses, and we're going to have a new normal where we're dealing with this. The first wave is going to be disruptive, but it's going to be something that's going to not go away until we have a vaccine. So you have to be prudent about what you do. Touch your face less, wash your hands more, and really get on with your life. But some of this is going to be disruptive, and you're going to see cancellations. You're going to see people panic buying, and it's going to be hard to stop that from happening because people are worried because of the unknown. Right. But this is something we can deal with.
Dr. Yasmin, let me turn to you because among many things that are fascinating in your career, I want to get to the idea of being a disease detective, but you're also trained as a journalist. You did a night fellowship where you looked at the spread of mis- and disinformation in the media surrounding outbreaks like this. Are you seeing a lot of misinformation and disinformation and hysteria being spread by the media this time?
We are unfortunately seeing misinformation spreading via social media, especially really early on in this outbreak. Even in the first few weeks, we were seeing conspiracy theories that were circulating on social media and online. We were seeing rumors spreading that people were recommending drinking bleach. Things like that were really dangerous went viral. And the reason that I've spent so much time studying this and started this initiative at Stanford is because the spread of misinformation can be as dangerous as the spread of infectious diseases. And in fact, the spread of rumors and health hoaxes can fuel the spread of microbes and make these outbreaks really dangerous. And so it's important that even as officials are dealing with the spread of this new virus, they have to pay very close attention to the spread of the rumors and the pseudoscience about the virus too, because that can also make their job harder and hinder public health efforts to stop the epidemic.
Rumors, pseudoscience, social media, they all create a kind of a toxic stew there. As you look at the coverage on, let me use the overused word, mainstream media, conventional media, are you seeing misinformation, disinformation? Has this been puffed up beyond where it ought to be in the popular conscience right now?
What I'm seeing is journalists work really hard to make sense of quite an uncertain situation. And I think this also reminds us of the very important role of journalism and having excellent science and health journalists at newsrooms across the country. When I did my research here at the Night Fellowship at Stanford, what I found was talking to editors in the massive newsrooms across the country, they were saying that they did not have a plan for when an epidemic hit the US. And they said that when it came to Ebola, they were, quote unquote, winging it. And that's that's how we ended up with an NBC journalist becoming infected with Ebola while trying to do his job and keep the public informed. So it's really important that we invest in journalism, we build trust between journalists and communities, and we make sure that science journalists and all journalists are safe while doing their job.
I'm going to try and squeeze in two more questions, one to each. Dr. Adalja, why does it appear that children are less susceptible to this illness?
I wouldn't say that children are less susceptible, but they're less susceptible to having the severe complications of this. And that may have to do with a couple of things. There's a couple hypotheses out there. One, children's immune systems are not robust, and we know that an infection is an interaction between the immune system and the invading virus. So maybe their immune system doesn't react as strongly, and those symptoms are less severe. It may also be that the children get lots of common colds, and we know that a quarter of our common colds are caused by coronaviruses. There may be more cross-reactive immunity that's protecting them from this novel coronavirus. But this is an important question to answer.
Interesting. Let me go to a soundbite here quickly. Earlier today, the co-owner of Milwaukee's basketball team, the NBA, the Bucks, Mark Lazary, told CNBC that sports events could possibly ban fans, we've seen this overseas, if the coronavirus outbreak worsens here. Let's listen.
Would you be willing, if it came to it, to play basketball games with nobody in the stands?
Would I? I'd definitely be there. So I'll be there.
Or could you envision a scenario in which it gets to that?
I think if the NBA determines that, that could happen. So if you're going to do it to basketball, you're going to do it to baseball, you're going to be doing it throughout with all these sporting events. So I don't know. I hope we don't get there.
Yasmin, is that something that makes sense to you?
It makes sense to have emergency preparedness plans in case this gets worse, just the same as the superintendent of Seattle schools was just telling you. It's really important that we have contingency plans for this to potentially get worse. It's still early days and we still haven't had really good testing capacity. So even those numbers that we're seeing of infected Americans, we're expecting that to rise. And in terms of mass gatherings, we're still saying in general it's okay for those to happen in most parts of the US, but we're watching this really closely and it is changing day by day.
Final question, quick, Dr. Yasmin. Do you think we will ever get to patient zero in this?
I don't know if we will, but I know that there are some brilliant scientists working on it. And so we're waiting day by day to see what information they give us and what we can glean from that. We've seen extraordinary efforts made already really quickly. So I'm hopeful that we do get some information, especially about how that spillover event happened from an animal species into humans. That's fascinating, and I'm watching that closely.